If you're looking for effective hip flexor stretching, and please watch this one. I'm sure you've seen already tons others on other YouTube channels, but I'm going to bring in a little bit different perspective how to stretch the hip flexors. I'm going to show you a few of my favorite stretching exercises that will not only help improve the flexibility of the psoas and hip flexors, but also will retrain the movement patterns that will result in a longer lasting effects. And by the way, if you haven't watched my previous psoas and hip flexor stretching video, and in that video, I talked about how to inhibit the psoas muscles effectively before you can actually stretch it. So be sure to watch that one if you haven't already. If you want to learn how to retrain your body and then movement safely and then effectively and then move better, subscribe to my channel and hit the bell to be notified when I post a new video every week. I am Taro Iwamoto. I am a Feldenkrais practitioner with my backgrounds in athletic training, physical therapy, martial arts, and the Feldenkrais method. I have helped many people like you overcome and then move beyond the pain and the limitations. Now it's your turn, and let's dive in. So the first one, I'm going to be on your knees. And you can skip this one if you're not able to kneel on the floor. Or you can do on the soft surface. So you can place the blanket, padding underneath if that works okay for you. So, on your knees, if you choose to do this one, you can now watch and follow me. And get on your knees and you stand on your knees. And from here, so you can just bring your hips back a little bit, just a tiny bit, as if you're going to sit on your heels, but just a tiny bit, okay? So from there, and you begin to push your knees down into the floor, and you can feel that your hip extensors, your glute muscles are starting to contract, okay? So you can just use your hand to direct that activation of the gluteus muscles, right? And then continue to push through the knees and then complete the hip extensions. And if you are already, if you have a short and tight psoas and hip flexors, as you are completing hip extension using your hip extension muscles, and you should feel a little bit of a slight stretch through the front of your thighs and hips. Well, that's a good sign, okay? You don't really need aggressive amount of stretching sensation in order to effectively stretch those muscles. What you're doing is you're really teaching how to extend your hip, which you'll be using in a normal daily activities, just as you're standing, as you're sitting to standing, so that this movement will retrain how to properly engage your hip extensors during activities. So from here, okay, so move your hips back a little bit, and then you're initiating the motion from your hip extensors by pushing your knees down, allowing the pelvis to roll and tilt backwards a little bit. There's no need to use your abs. So if you're bracing your abs, let it go. It has nothing to do with the hip extension, right? Back a little bit. Engage your hip extensors, complete the hip extension, and you should feel a little bit of stretch. And that's all you need to do, right? Easy to do. And you go through this motion very, very slowly. You can hold the stretch like 10 seconds, all right? And then going back, intentionally using your hip extensors to complete hip extension. Hold it for 10 seconds and repeat that 10 times. 10-second hold, 10 times. Unlike a regular stretching where you hold the stretch 30 seconds or longer and do repeat like 3 sets or so. This one is focusing on retraining the movement patterns so that you can start to use this motion using the hip extensors to coming out of that flex positions so that you are more effectively completing then hip extension, and then lengthening the hip flexor muscles, psoas muscles. All right, so that's one position. And then the second position is half kneeling. So put your one foot forward, standing, and then the other one is here. So you're not leaning forward. Hip is directly over your knee. And you've probably seen this one, you've probably done this stretch. This is a pretty common hip flexor stretch, right? You've probably seen this one and like seen people teaching you how to, lean forward until you feel the stretch in your hip flexors. You don't need to do that. If you already have a tight and short hip flexors, most likely even in the neutral positions that you are maintaining that anterior pelvic tilt and then not really completing the hip extension. So all you need to do is learning to extend your hip, by pushing this knee down into the floor, and you can feel the left side of your glutes. Hip extensors engage now. That will bring the pelvis into more neutral. You feel the lengthening of the hip flexors. So there's no need for you to lean forward because this is not about using the hip extensors. This is just you are moving into the hip extension, but at the same time, you are moving into the lumbar extension, right? So if you do have a trouble in being able to extend your hip properly, and then by doing this one, most likely, more than you're stretching your hip flexors, you are stretching your lower back. By doing that, this is not a good way to train the movement patterns because what you're training is you're associating the lumbar extension with the hip extension. But you want to be able to differentiate hip extension from lumbar extension. You don't have to do them all together, right? So learning how to engage your hip extensors to complete hip extension. And then in this neutral position, this is enough for you to feel the stretch, right? If you are able to properly engage the hip extensors, you can use your hands to guide it. So the pelvis, from anterior pelvic tilt, it is by engaging the hip extensors, it brings the pelvis more upright, which will lengthen your hip flexors, your psoas muscles. Then you feel the stretch right away. And you hold the contraction, you hold the stretch. Again, it has nothing to do with your abs. So let go of your abs, not needed, okay? You don't need to use your abs to keep your back neutral because if you're differentiating hip extension from the lumbar extension, you should be able to just extend your hip without moving your spine. Then you feel the stretch. Hold the stretch for 10 seconds and then let go. Let go, it's okay to let the pelvis kind of spill forward and then engage it by pushing the knee down, driving the knee down, and then you feel the lengthening here. And you repeat that 10 times. Again, this is more about retraining the movement patterns. So for that purpose, you're doing that repetitions just to reinforce that patterns, movements. And then you can start to incorporate that patterns in walking, for example, right? Every movement that requires the push off, pushing through that leg, your intention is trying to use that hip extension rather than just throwing the pelvis forward. Okay. All right, and one more. You can do the same thing in standing, split stance, and this is sometimes called the runner's stretch. It's a common hip flexor stretch as well as the calf stretch. Right? So to do this one, again, it's so common. You see just leaning forward and trying to throw the pelvis forward and stretch it. Yes, you get a little bit of stretch, but at the same time, what you're doing to your back is you're really extending your back. Not a good movement patterns. And if you already have a lower back discomfort and pain, by doing that, well, commonly the lower back pain and then the tight hip flexors, they kind of are together. So it's not unusual to be prescribed the hip flexor stretching. somebody with the lower back pain, with the tight hip flexors, right? And then you're doing that, yes, to reduce the stress to the lower back, but at the same time, you are training your nervous system and the movement patterns of the associating back extension, lumbar extension with the hip extension. Not very good, right? You want to disassociate the patterns, lumbar extension from the hip extension. So to do that, you're getting into the split stance, and then you're driving the back foot down to facilitate that extensors of the hip, right? The gluteus muscle. And when you do that, and then your pelvis, the activation of these muscles are going to bring the pelvis more into the posterior pelvic tilt directions. So it moves out of that anterior pelvic tilt. Nothing to do with your abs. Okay? You may be trained to tighten your abs and brace it. Better not to use your abs. Because if you associate your abdominal flexors with the, to keep the spine stable, and constantly you're going to flex everything down. And then in that compromises your breathing too. So leave your abs alone and then just see if you can differentiate the hip extension from the lumbar extension here, and without using your abs at all. Direct that force. Drive the foot down and back, and to activate your hip extensors, which is going to bring the pelvis backwards or more neutral. Lengthen the spine, lengthen the hip flexors and psoas muscles. That is enough to feel that stretch. No need to throw the pelvis forward and try to get more stretch. You don't get more stretch. You're stressing your low back more than stretching your hip flexors. Makes no sense, right? So do this one again, 10 seconds and 10 sets. Think retraining the movement patterns more than stretching the muscles, because in order to actively and in order to effectively stretch your hip flexor muscles, you have to be able to contract, you have to be able to engage your hip extensors effectively, and that's the key thing, which will then lengthen the hip flexors and psoas muscles. So always think retraining the movement patterns more than just stretching the muscles. All right. Oh, by the way, you don't have to do them all. I'm just to show you a variety of ways to do that. But it's the movement patterns are the same. Whichever works the best for you, you can use it. If you have a hard time kneeling down on the floor, you don't need to get down on your knees. You can just do it here, and that's fine. Just remember, it's not about pushing the pelvis forward to stretch it. In order to do that, learn to engage your hip extensors without engaging your abdominal muscles, or without engaging or without extending your low back. And that's it. It's quite helpful. And then again, before you do this active stretching, I highly recommend my previous video where I talked about how to inhibit your psoas and your hip flexor muscles. And once you're able to inhibit those muscles, and then you are much more efficiently able to stretch your hip flexor muscles. So try that. If you want to improve your back pain, be sure to grab your free movement guide to pain-free back at the link below. Check out these videos, and if you like this video, and hit that like button, and be sure to subscribe and share with your friends. Comment below how helpful you found this video was. Thank you so much for watching. See you in the next video. Happy mindful movement. Bye-bye.